subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to welcome back to our Seniors Today Health Live session series, Dr. Kaustubh Mahajan. And before I invite him to speak about the topic that we have, which is memory matters and brain health basics, let me introduce Dr. Mahajan. Dr. Mahajan is a well-known neurologist in Mumbai with over 15 years experience in the field. He is consultant neurologist at the PD Hinduja Hospital and Medical Research Center at Khar in Mumbai. He is also attached to consulting at a few other hospitals in Mumbai. He has completed his MBBS and post-graduation from the Seth GS Medical College in Mumbai and completed his training in DNB Neurology subsequently. He's also a member of the prestigious American Academy of Neurology. He is a member of IMA, MCI, and the Neurological Society of India. He specializes in headaches, stroke care, movement disorders, and epilepsy. Today, we've invited Doctor to speak about a topic which is a little different from what he has spoken with to us in the past, and this is about memory matters and brain health basics. Welcome back to Health Live at Seniors Today, Dr. Mahajan.
Hi.
So the topic that we have is brain health basics and memory matters. So over to you, doctor, and you can start your presentation. Doctor has a presentation, and after that, you can watch it and ask your questions in the chat window, and I will address it to Dr. Mahajan. Over to you, doctor.
Okay, thank you. I'll start my topic with most of us nowadays when we take our phone in our hand, sometimes to message someone, and then sometimes we just forget why we took the phone, and we kind of start scrolling away to certain things, and then get distracted to them, just knowing and realizing that we just forgot to do the main purpose what we were supposed to do. So I guess this must be happening many a times. Initially, it was more of we used to go to some room to take something, and then we forgot why we went to that room in first place. Or when you open the fridge to take something and you forget. So these are some signs where if you have started to note among your relatives or among yourselves, then yes, one is starting to develop early signs of forgetfulness. Forgetfulness is a very kind of a broad term where it can encompass to many issues of memories. What we are more worried about is forgetting things from the recent memory, and that's the one thing which is very common, where things from the past, old things are remembered, but whereas things what are happening, what happened yesterday, what happened few days back, are not remembered, as the example of taking the phone to send a message to someone. So the basic of memory in our brain is as simple as that of the computer also. We have something called as the hippocampus, which is the RAM of the computer, which is the main force behind the working memory. And the second thing is the hard disk in the computer, which stores long-term memories. So that's the frontal lobes of the brain. Uh, Whenever a person is going through dementia or a person is forgetting things, especially elderlies, the problem is mainly in the hippocampus. The hippocampus is basically a center in the brain which is in the temporal lobes. Temporal lobes are here inside, and they are responsible for recent memories. Now, say example, if the same example, you want to send a message to your colleague, and it's an important message. Your colleague had said that you will have to, once you get the news, you please send me as soon as possible. Now you took the phone, but before you send, open your WhatsApp and send a message, you get a call from someone, you start talking, then you keep the phone down again to start messaging, but then there's a pop-up which comes, which is an email pop-up. Then there's another notification. You try to scroll through all those, and then you keep scrolling through those other notifications and that certain page. And only just because of the algorithms these apps have made in such that you tend to doom scroll. Doom scrolling is a new word which basically means you keep scrolling mindlessly and keep getting distracted because the algorithm knows what you want and what you desire to see. And then that's when your hippocampus, which is trained to keep certain 7 8 recent memories at a given time to be attended, gets overwhelmed by 10 15 distracted things. And that's when the first thing which it was allotted to, which it was meant to, say sending phone a message to your colleague, that gets wiped away. And then only to realize that you have forgotten what you primarily took the phone for. So these are the things which how a kind of uh, the recent memory, which is more important, things are getting away, and the least important things are filling your memory space. And these all connections keep happening in the brain. These are all in the form of synapses, which are basically chemical connections in the brain, and only to overwhelm the brain in the night, when the clearing process of these unwanted synapses happen. And then certain toxins get accumulated which have to be cleared, especially in your REM sleep, the later half of the sleep. And if you have sleep issues, especially the sleep is interrupted, and you are not getting enough of later half of the sleep, then it is bound to happen that these toxins get accumulated, and these toxins will in future kind of cause damage to the temporal lobes and hence cause dementia. So this is the basic structure why a person starts getting dementia, because of inappropriate clearing of the toxins in the brain which have occurred. Okay, now so that's the temporal lobe, which is mainly important. We will go to a small presentation, which is how these dementia things happen and how to take care of such patients. Dementia creates two victims. One is the patient himself. Second, the caretaker as as patient dementia worsens, his symptoms may worsen if has not learned how to handle dementia. So basically, any caretaker or an attendant who has lived with dementia knows how frustrating it can be, because the patients with dementia keep doing the same mistakes again and again, and it becomes very frustrating. So if you don't know how to handle these patients, uh, there's something called as caretaker burnout, which is bound to happen in such relatives who have and in fact, the whole family is disrupted because of one patient of dementia. And the happiest person in that family is the patient with dementia, because he doesn't know anything, he doesn't remember anything, and he keeps doing mistakes which can be troublesome for the relatives. So there are certain myths about dementia. First myth: dementia is a disease of the old. Second myth: science is growing and we may have a cure by the time we become old and we get dementia. Dementia can be, I'll discuss in detail all these. Dementia can be cured with present medicines or can at least prevent it from worsening. Dementia can be prevented if genetic background present, cannot be prevented if genetic background present. Dementia means Alzheimer's, they are one and the same. Okay, so first myth: dementia is a disease of the old. So, not necessarily, dementia is of many. So, dementia is a broad term for a degenerative condition of the brain where the main domain of memory is affected. It's not only memory which is affected, you can have certain other features like behavioral change, like functioning change, like perception change, like psychological effects. All these are other domains which can be affected. But of this, memory is the most important thing which gets affected. Uh, and it can happen in young patients also. It all depends upon the cause. Science is growing, and we may have a cure by the time we become old. So, the maximum research which is happening in US now is in dementia, because we are seeing that the age threshold is increasing in all. In the most of the developed countries, US, UK, Japan, Germany, we see a lot of elderly people, and a lot of these patients are going through this crisis of dementia. So no doubt we want a good drug which can cure. Unfortunately, we don't have such any good drug right now, but we have certain medicines which can kind of control the symptoms but not cure the symptoms. So the problem is when a patient with dementia starts getting the symptoms, the problem in the brain has actually started 40 years prior. And slowly, it has been degenerative. And once it has gone beyond the limit, beyond the threshold of irreversibility, then only the symptoms. So it is kind of decompensated. The brain keeps compensating for the abnormal structuring in the brain which the dementia has caused, and eventually when it fails to compensate, you start developing the symptoms. So it is already 80% of the damage has been done. That's why reversibility becomes an issue, and so finding a good drug to reverse it is difficult. Same way like a cancer which has spread everywhere and then shows symptoms, it becomes very difficult to treat such cancers. In the early phase, it's easy to treat because it's small, but when it has spread everywhere, you give any medicine, it is not going to. Similarly, in dementia, it is already 80% damaged the brain, so reversing it becomes difficult. So that's why it cannot be cured. And with respect to present medicines, though science is improving, we are so basically what science has told us now is that the problem start 40 years back prior, and that's why preventing it when you are 40 will make more sense and will be more easier for you to prevent dementia later. Dementia can't be prevented if genetic back. So this is also a good point. But if you have a genetic background where you have many relatives who have dementia, you cannot prevent it. It's not completely true because usually we see with this that genetic background is mainly giving you the tendency, but your environmental influence is mainly responsible ki how severe and how early you will get the symptoms of that genetic disease. So basically, in simple words, in any genetic condition where you are prone to have is like holding the gun of the genetic tendency, but the final trigger is pulled by the environmental influence. So, still, even if you have a genetic background, by changing your environmental influence, you can change the outcome. Dementia can't be, yeah. Dementia means Alzheimer's, they are one and the same. So, I think most of us, you must be knowing the Alzheimer's dementia, which is the most common cause of dementia in elderly, but there are multiple causes of dementia. Alzheimer's is just one of the cause where memory domain is the most commonly affected. You have also something called as frontotemporal dementia. You have also something called as reversible dementias. Now, if you have seen English movies where you know Bruce Willis as an Hollywood actor, he had symptoms of frontotemporal dementia. Frontotemporal dementia is different, Alzheimer's is different. Alzheimer's is mainly memory issues, frontotemporal dementia is mainly behavioral issues. There you get this prosopagnosia where you have a problem with recognizing faces. Known faces you don't remember. So they are not one and the same. Okay, so what can be done? So, so what can you do now so that you don't develop these problems later? And remember, the most important risk factor for a person to develop dementia is age. As you age, as the synapses connections keep happening, as you unwanted synapses connections keep happening, as the toxin damage increases, you start developing these features of dementia. So, first point to know is to reduce the toxin damage accumulating in our brains throughout our life. Second, to improve circulation. Third, to improve brain reserve. And will certain foods help? So, first point, so to reduce the toxin damage accumulating in our brains throughout our life, we what can we do? So, the unwanted connections which your brain is not going to preserve, the brain has a tendency to keep the wanted connections, and unwanted it will delete. So these unwanted things are in today's world. Our brains are definitely overwhelmed by these stimuli. So whether it be social media, whether it be YouTube, whether it be the newspaper. So many information is bombarded on us, and we keep doom scrolling. We keep scrolling on them. So the word is doom scrolling. I think Oxford Dictionary did have this word of the year, where I think the award went to the word brain rot. So I think it's a understandable word where when a person who is hooked on social media and keeps doom scrolling, the brain is exposed to so many stimuli, and it's kind of a feature of reducing attention, reducing memory later, and has been termed as brain rot. So that got the word of the year this time. So that's about to reduce toxin damage. What sleep is the most important thing, which does the job of clearing of these toxins, and REM sleep, which is the later half of the sleep. So ensuring a good uninterrupted sleep is important so that this clearing happens. In today's world, most of the times we see to have our me time, many youngsters are sleeping late, watching binge watching Netflix, and compromising on your sleep, and so just the opposite is happening to improve circulation. Now, the better circulation your brain has, the better clearance of these toxins, the better opening of the arteries and providing good nutrition to the brain. So, how can you improve the circulation to the brain? There are many things. One is, if you have diabetes, blood pressure, control them. If you are smoking, stop smoking. Most important thing is you do exercise. So, in a normal healthy brain, actually requires around 8 kilometers of daily walking. So unfortunately, none of us do that. So that's not good. Where the more aerobic activity in the form of walking, running, cycling, swimming, the better circulation your brain will have. Over the period, arteries start becoming narrow, thickening, blocks. Like you get coronary artery disease, you can get brain strokes. But if you have a good collateral circulation because of a daily exercise schedule, you definitely can prevent strokes in future and prevent dementias later on. To improve brain reserve, so how do we improve the brain? Because of these toxin damages, slowly the brain starts shrinking. So a good way is to improve the brain reserve. How do you improve the brain reserve? Is by making wanted or significant brain connections which are not going to be deleted. So how do you do that? Is by learning new things and revising them, so that you keep learning and the memory stays. So learning a language helps, learning a musical instrument helps, but it's not just one class. It has to be practiced again and again, and you have to kind of master it, and that helps in increasing the brain reserve. Will certain foods help? So this is the question which many people ask. There are many foods will cause a problem, so you avoid that. So especially anything which will block the arteries, like oily stuff, food, carbohydrates, this is not good for the brain. Increased glucose is not good in the long term for the brain. For short term, definitely it gives you energy. Mediterranean diet, which is rich in veggies, fruits, vegetables, raw fruits, all these are good. There's a new study which has told that ketones are good. So, what is ketones? Basically, what happens after intermittent fasting. So, when you fast, you have less of glucose because you have not eaten anything, and then the body's fat reserves are used for energy purpose. And when that happens, then ketones are produced. And now it is proven that these ketones help in clearing the toxins better. So, simple practical steps what you can do now is first is having a purpose. Join club organization that need volunteering. If you start now, you won't feel lost and unneeded after you retire. So what this means is basically this concept of retiring is not good for the brain. Uh, if say you're 50 years and you say after 60 I'm going to retire and not do anything, is not going to be healthy for your brain. You should have a plan at the age of 50, at the age of 40, what you will be doing after 60. um, you should be busy with some hobby or with some dream which you have. I get surprised by knowing that many people don't have any dream, that they want to do certain, they want to find something. It's just like a routine rat race. Everybody is going on through their lives. So do have a purpose, and that will help you to kind of keep you active. Develop a hobby will help build new connections as you are trying to build, as you are trying something new and complex. Example, gardening. Example, learning some music instrument. So anything what you like. Practice writing with your other hand. So whenever you shock your brain with something, like so even this, having a cold shower, or practicing writing with your other hand, so where your brain gets challenged, this definitely helps to open new connections. Take dance lessons. So dancing is a very good way of kind of socializing, as well as physically doing an aerobic activity. So also learning something new. So three, four things happen together where your brain uh, is helped. So walking daily, 10,000 steps a day, get good uninterrupted sleep, read and write daily, writing what you read or explain it to someone and not just copying. Basically, it's just revising of what you have read, so that that connection is kind of rewired again and again so that you remember. You can start something as simple as knitting if you don't know. Learn a new language, learn a new musical instrument, playing board games like Scrabble, which will challenge your brain, learn something new, take classes, meditate or be mindful, learn to shut off the unnecessary stuff, stresses of daily life. So basically, meditation, how does it help? Uh, it increases your attention, it increases your awareness to know what is not needed, what is needed, and helps you to focus on things what is needed. It also helps to filter off the unwanted things. So let me come to the last part, basically the caregiver burden. If you have any patient of dementia in your home, and you must have noticed how frustrating it can be. There are actually two types of dementia patients. One can be very dull, calm. They are the good ones where they cooperate. And most of them are the other ones, which are restless, irritable, angry, violent, abusive. So then the caretaker has a hell of a time. So, caring for loved ones with dementia is challenging and stressful for family members who have to provide the home care. The responsibility takes a huge physical, emotional, and financial toll on the caregivers, which is known as caregiver burden. The survival and quality of dementia patients have been shown to be related to the well-being of the caregiver. If the caregiver is healthy, the dementia patient will be healthy. Um, but it always happens ulta. The dementia patient keeps making the caregiver unhealthy, and then it backfires. So, an overwhelmed caregiver can result in premature institutionalization and increased healthcare utilization. The physician should assess caregiver for the level of perceived burden, presence of depression, anxiety, social support, behavioral problems in the care recipients, and coping strategies, and help the patients and the caregivers. To reduce the burnout, understand how these patients think, and remember that they will not remember anything that you have said, even if it is repeated 10 times. So, this is the most common thing, frustration which people go through, relatives go through. Uh, Say the patient with dementia has to pass urine, and now instead of opening the door of the washroom, he passes urine elsewhere. So you keep repeating that same thing 10 times, you are going to get more angry and frustrated. The patient will will hardly make any difference to it. So, how to handle these situations is by knowing first कि talking to them, arguing with them is not going to help. Instead, you'll have to have a plan. Like when instead of waiting for the patient to pass urine, you usually take them at every 2 hourly intervals to the washroom and make them sit. So then they usually pass urine, and so the problem of forgetting where it is going as per demand will not help. Never argue with patient as it is pointless. Use mirroring and dancing music as communication. This is one way of communicating. where when they are happy by other ways rather than just talking. If you use mirroring, like you want to drink water, you show them that you want to drink water, and that is mirrored, and they do the same thing. Dancing and music also can be a good way of communicating. Okay, that's it. So any questions, you're free to
Yeah.
ask.
Thank you very much, Doctor. Even as I take the questions, I must, as you're aware, seniors today, we have over 116 people here today. Yeah, so we as part of seniors today, we also have the Evergreen Club, and I must, you know, uh, I have great pride in telling you that we've been running apart from the health webinar, we have something called Seniors Have Talent, which is only open to people above the age of 60, and we have done 16 seasons of that, and the 17th season is starting next week, and this is only for people above 60. And we've gone through the lockdown and everything, and people we have tried to engage a lot of people over a period of time. Apart from that, there's the Evergreen Club that we run, and there are around 20 events that are there, and once again involving people in various ways. And we've been discussing this whole thing about dementia, and I think somewhere perhaps we should start a support group for caregivers in the case of dementia, because a lot of people don't understand what it is, and a lot of people, caregivers, as you mentioned in your last few slides, there's a lot of irritation which happens also with for caregivers, and I think it's important to note that. But we will come back to our readers about it, and we will take the help of senior doctors like Dr. Mahajan for this. Uh, a lot of questions have come in, and a lot of answers have been given by Dr. Mahajan, so I'm not going to take those. But there's a statement which is made by Meena Goyal, and she says things which are most attached to our life always remain in our subconscious mind. Would you agree?
So the definition of subconscious mind becomes important here, and so in a general way, yes, what is most attached to you, say the memories of your childhood, your mom, your dad, even when you forget, um, say you have dementia at the age of 85, 90, your old memories are always intact. So unfortunately, what happens is your whole 60 years, 70 years of life may be wiped off, and you may be living in that 20 years age, 30 years age, before marriage age. So that is one way of saying that yes, your subconscious mind attached things, or sometimes memory always has this way of building up. Like anything that has made a big impact on you will directly go into the frontal lobe from the hippocampus. It will not stay in the working memory. So, so, yes. So the simple answer to that question is yes.
Doctor, I know you've said this, but supposing now today I receive a phone call, and I'm sure all of us face it, and we forget to call the person back. Is that something to worry about?
So, so it's normal that if your hippocampus is overwhelmed by 5 6 things, and then you forget the first thing which was meant to be done, that is normal, because you got overwhelmed by 5 6 distractions. Normally around 6 to 7 at a given time, the hippocampus can be attended to. Um, what is the difference between a normal brain and a dementia patient brain? Now, what happens? Queuing. So, in a normal brain, you take your phone to make a call, you forget, you do other things, and then when you again see the phone, then that visual memory will get stimulated, and you will know, oh, how can I just forgot to make a phone call. But in a dementia patient, even with the visual cues, they will not remember. So that is one of the ways of how to differentiate between normal brains and dementia. The recall happens in a normal brain after some time, because the brain was attending to other things. In a dementia patient, the recall doesn't happen even when the stimulus is again stimulated. I
Now,
hope
uh,
something.
yeah, you have answered that. But just to kind of take the point further, for instance, I'm sure, say somebody like yourself, you have a lot of patients who come to you on a daily basis, and somebody visits you again after a couple of weeks. Now you have a case file to remind you, but would you then advise people like these to perhaps keep a notepad, close to them where their phone is, or at various places to write down, okay, this person has called or whatever? Is that something that is would be advisable?
So for people of by like us, where we have seen many patients in a day, to tell you frankly, we really don't remember patients by names. When a person calls that I had met you, so many patients call us and tell, you called me Maushi, you called me auntie, but we call everyone auntie and Maushi. So we don't remember them by names, and we have to kind of read our notes, and we tell them to send it on WhatsApp, and then we kind of recall by reading our notes only, not by the patient's voice or by the patient's name or by. So you do need, when you are overwhelmed by so many things, definitely there is no doubt you will need some notepad note system to remind you what it was or who it was.
And there's nothing to worry about in case you do forget, when you have so many things to worry about. Doctor, there's a question that you answered it, but since it has been raised, there's somebody who's mentioned, Shilpi Bishwas, my father was an Alzheimer patient. Can this be carried out to us as well?
So it depends upon at what age this dementia happened. If it was early, then there can be a genetic tendency. But as I said, it's very common for a patient above 85 to get dementia. So it's like above 60, around less than 10% will have dementia. Above 70, around 20%. Above 80, around 30%. And above 85, it will be like 40% will have symptoms of it. So the risk keeps increasing. So it's kind of normal for a person to have memory issues above a certain age. So it need not be genetic.
And doctor, amongst your patients who do complain about dementia and do complain about memory loss, right now in a city like Mumbai or in India, what is the percentage of people who have, you mentioned about 60 to 70, 70 to 80, 80 plus. What are the
So we
numbers
are
like?
seeing, yeah, we are seeing above 60 many patients. Less than 60 also we are seeing, 57, 58 we are seeing. But probably in my practice, there will be 10% and the remaining 90% will be above 60.
There's a question which has come from Katie Dadachi, uh, whose question is, do any strong allopathic medicines cause dementia in seniors?
Okay, so good question. Where there are many medicines, especially in psychiatry, where these medicines can deplete acetylcholine, which is the main communicating neurotransmitter, and cause memory loss. But so I will say it can cause memory loss. I won't say it can cause dementia because you stop the culprit drug, then things can be reversed.
Right. There's a question from Sunita Verma. Can yoga and meditation help in keeping our brains healthy?
Yes, it can.
It can, okay. There's a question from Satish Kalia, who's male, 79 years old. He's been diabetic for 15 years. He's showing early signs, initial signs of dementia, forgetting things, irritation. What can be done at this age by myself to prevent further damage? Yes, he's 79.
Okay. So, depending on first, if he has symptoms, it's always better that he meets a neurophysician where it will be graded what kind of dementia, and he will be evaluated for reversible causes also. There are many reversible causes. There are certain blood tests and imaging which we do. And if we are lucky, we may find a reversible causes. And
Right.
second thing which we do,
I think we've
and if we
lost
are
you.
lucky, we may find a reversible first thing which we do. Yeah, so that is the first thing that we would do, find out reversible causes. And second thing is evaluate the scoring of his dementia and treat if it is necessary. And third is
Doctor has a weak signal.
Thing is as a lifestyle modifications.
Right.
Hello? Yeah, am I audible?
Yes,
Am I
you are
audible?
audible. Yes, you are audible. Right. So
Yeah.
you mentioned about
So,
lifestyle modifications. Yeah.
yeah. So,
Doctor, there's a question which is coming from Anupama Singh. She asks, what are any alternative therapies on non-pharmacological interventions for dementia in addition to medication?
so in fact, I tell all my patients that medication is not the proper treatment of dementia. In the main treatment is in the lifestyle modifications or the pharmacotherapy treatments. And the non-pharmacological treatments, as I mentioned in those slides, is having an uninterrupted sleep, daily exercise, socialization, having a hobby, having a purpose, all these things, learning a musical instrument, learning a language, basically anything that will increase your brain reserve, anything and everything that will increase your brain circulation, anything and everything that will increase the toxin clearance in the brain. All these three things, where whatever points I mentioned, those points will help in doing those three things.
Right. Right. Thank you, doctor. There's one more question that has come in from Meenal Bajaj, who says, my left lobe on top has pain in recent times. Sometimes it's worryful. I forget names of people, but remember soon. Is this a symptom of Alzheimer's, dementia?
So one thing I can assure you that when a person is aware that he or she is forgetting things, then you don't have dementia.
Yes.
The one of the big differences in dementia is that they are not aware that they are forgetting. They are forgetting that they forget, and that's why these patients are always brought to us by their caregivers or their relatives कि ये भूल जाता है. And when you ask them the questions कि what is bothering you, then they say मुझे तो कुछ नहीं हो रहा है, I am तो perfectly okay, I don't know why they have brought me. So this is a classical scenario of a patient with dementia where they are not aware. So the fact that you are aware, you're forgetting, definitely there must be some reversible cause where you should meet your physician and then they can sort it out. You will be surprised, there's so many reversible causes like improper sleep, snoring, um, getting up frequently for urination. All these things break your sleep, and you just try to correct them. Your sleep is good, but that's what you have to start early. You have to start early in the sense, like many years back, then the sleep issue kind of gets sorted out.
Right. Doctor, this is a question which has come from Mr. Radhakrishnan. Can spondylitis affect the brain functionality?
So indirectly, it can. Spondylitis can cause less mobility, um, back pain, neck pain, and that less mobility will cause make you less aerobic active, and that can in future cause memory issues, but no direct relationship.
Doctor, one last question, and there's somebody has also asked, is there a blood test that is there? How do you ensure that you get, you know for sure that this is how you're going? Because various other illnesses you can predict. Is there something that you can do to predict in terms of a diagnostic test?
Yeah. So when you say dementia, especially if you are going to diagnose Alzheimer's dementia, the diagnostic test to confirm that is not a blood test, is not an MRI. It is basically a questionnaire. So you go through that questionnaire where another person has to answer you those questions, and then there's a scoring. And out of that 30 score, how much you score will tell us whether you're having dementia or not. Uh, to rule out reversible causes, we do the blood test, we do certain imagings like MRI, and we do certain other tests like ECG to deco, where we will rule out other causes or reversible causes. But essentially, in Alzheimer's dementia, if you are speaking, all these tests come normal, and it is the questionnaire or the clinical scoring which is done on paper which diagnoses it or confirms it. We call it as neuropsych evaluation.
Right. Doctor, this is a question which is somebody has asked, and I know it's not about a senior, but his son is 31 and he's afraid of traveling alone, feels upset, anxiety. Psychiatrists have given him some medicines. Is there something that he can do to ensure that he gets okay?
So I would rather say medicines are a quick fix solution, but in the long term, if you really want to cure the problem, he will have to meet a psychologist as well. And there's some kind of anxiety and fear which has developed because which is causing him to become claustrophobic or travel alone. That has to be kind of dealt with us by a psychologist and by counseling, and by there are many ways sensitization where that root cause of the fear is addressed and removed, and medicines will be only a temporary quick fix solution. So meeting a psychologist will help.
Right. Thank you very much, Doctor. There are quite a few questions that have come in, but some of them have been addressed in your presentation already. Once again, thank you for taking your time. Thank you to the Hinduja Hospital for facilitating this. And to all of you there, please do remember we will be back next Saturday at 5 p.m. with another session of Health Live at Seniors Today. Remember, the next issue of Seniors Today, and which is a special issue, our January issue has the 50 top influentials. So look out for that, which will be there on the 15th. 15th is also our season 17 of Seniors Have Talent. And of course, you can be there for all our Evergreen Club activities. Thank you once again, Dr. Mahajan, for being there. We hope to have you once again in the years to come. And thank you, all of you.
Subscribe now and press the bell icon. Never miss an update.